These 5 tests may seem harmless, but they disrupt your blood pressure and pose serious risks. Have you ever walked into a doctor's office feeling perfectly fine, only to be told your blood pressure is dangerously high? That sudden pounding in your chest as the nurse wraps that tight cuff around your arm, watching as the numbers climb higher and higher on the monitor. I've seen it countless times, that look of confusion and fear washing over my patients' faces when they hear those words, "Your pressure is too high." For millions of Americans living with hypertension, this scenario plays out daily. Nearly half of all adults in the United States, that's a staggering 119.9 million people, are battling high blood pressure right now. Even more alarming, almost 70% of adults over 60 are affected, and many don't even know their blood pressure is silently damaging their bodies with every heartbeat. What's truly concerning is how certain medical tests, procedures you might think are completely unrelated to your cardiovascular health, can secretly send your blood pressure soaring, creating false readings, triggering unnecessary medications, or even masking serious conditions. After 3 decades of working with hypertension patients, I've identified 5 seemingly innocent medical tests that regularly disrupt blood pressure readings and could be putting you at serious risk without you or even your doctor realizing it.
Before I reveal these hidden culprits, understand this isn't about avoiding necessary medical care. These tests are often vital for your health. But knowledge is power. Knowing how these procedures affect your blood pressure gives you the tools to work with your healthcare provider for more accurate readings and better treatment decisions. After all, misdiagnosed or improperly treated hypertension can lead to heart attacks, strokes, kidney failure, and vision loss. The stakes couldn't be higher. Today, I'm pulling back the curtain on these 5 common tests that could be giving you and your doctor the wrong impression about your cardiovascular health. Some might surprise you, as they have nothing to do with your heart at first glance. But I promise, understanding these interactions might be the most important information you receive about managing your blood pressure this year. So take a deep breath, and let's explore why these routine procedures could be affecting your readings in ways you never imagined. I want to ask you something important before we continue. When was the last time you felt truly heard when discussing your blood pressure concerns with a healthcare provider? Not just the numbers on the chart, but your actual experience living with this condition day after day. I hear from so many patients who feel brushed aside, given generic advice without consideration for their unique situation. If you've ever felt this way, I'd love to hear your story. The reality of managing hypertension goes far beyond medication and diet. It's about navigating life with an invisible condition that affects everything from your energy levels to your emotional well-being. Sharing your experience not only helps me create more relevant content, but it might just be exactly what someone else needs to hear today to feel less alone in their journey. Now, let's dive into these 5 critical tests and understand their hidden impact on your blood pressure. The first test that might be throwing off your blood pressure readings is something millions of Americans undergo every year, the cardiac stress test. Whether you're walking on a treadmill or receiving medication to stimulate your heart, these tests are designed to put your cardiovascular system under pressure. What many patients don't realize is that this intentional stress doesn't just end when you step off the treadmill. Your blood pressure can remain elevated for hours afterward, sometimes even for a full day following the procedure. Imagine coming in for a regular checkup the morning after a stress test, and your doctor, unaware of yesterday's procedure, sees your elevated numbers. This could lead to unnecessary adjustments to your medication regimen or even new prescriptions you don't actually need.
The cardiac stress test works by intentionally increasing your heart rate and blood pressure to assess how well your heart functions under exertion. The test typically involves walking on a treadmill while gradually increasing the speed and incline, or receiving medications like dobutamine that make your heart work harder. During the test, your blood pressure might rise from a normal reading to 160/90 or even higher. That's by design. But here's the crucial part most patients aren't told. This elevation doesn't immediately return to baseline when the test ends. Your sympathetic nervous system, the fight or flight response, remains activated, keeping your blood vessels constricted and your heart pumping harder than usual. For patients with existing hypertension, this prolonged elevation can be particularly problematic. Studies show that blood pressure can remain elevated by 10 to 15 points for up to 24 hours after a stress test. If you're scheduled for any blood pressure-related appointment within that window, make sure to inform your healthcare provider about the recent stress test. Better yet, try to schedule routine blood pressure checks at least 48 hours after any cardiovascular stress testing to ensure you're getting the most accurate assessment of your true baseline pressure. The second test that frequently disrupts blood pressure readings might surprise you: contrast-enhanced imaging studies. CT scans, MRIs, and certain X-rays often require the use of contrast dye to highlight specific areas of your body. These contrast agents are generally safe, but they can have a significant impact on your blood pressure that few patients are warned about before the procedure. The iodinated contrast materials used in CT scans can cause dramatic shifts in blood pressure, sometimes dropping it dangerously low, but often spiking it significantly higher, especially in patients already managing hypertension. When contrast dye is injected into your bloodstream, it triggers several physiological responses. First, the solution is typically hyperosmolar, meaning it draws fluid from surrounding tissues into your bloodstream, temporarily increasing blood volume. This sudden volume expansion forces your heart to work harder, raising your blood pressure. Additionally, contrast agents can trigger the release of histamine and other vasoreactive substances that directly affect your blood vessels, causing constriction in some patients and dilation in others. For those with sensitivity to these substances, the pressure spike can be substantial, sometimes jumping 30 to 40 points systolic within minutes of injection.
What makes contrast reactions particularly concerning is their unpredictability. You might have had contrast before with no issues, only to experience a significant blood pressure reaction during a subsequent scan. The risk increases for patients over 60, those with existing kidney issues, diabetes, or heart failure. If you're scheduled for a contrast-enhanced imaging study, consider monitoring your blood pressure for 24 to 48 hours afterward. And be sure to mention the recent procedure to any healthcare provider measuring your pressure during this period. Some patients may even benefit from pre-medication with antihistamines or corticosteroids before contrast administration if they've had previous reactions, a conversation worth having with your healthcare provider. The third test that consistently interferes with accurate blood pressure measurement is fasting blood work, those routine labs your doctor orders where you need to avoid food and drink for 8 to 12 hours beforehand. While seemingly straightforward, fasting introduces several variables that can significantly alter your blood pressure readings. Dehydration from avoiding fluids, low blood sugar from skipping meals, and even the stress and discomfort of hunger can all contribute to abnormal blood pressure measurements taken during or shortly after your fasting period. During a typical overnight fast for morning blood work, you might go 10 to 12 hours without adequate hydration. Even mild dehydration reduces blood volume, triggering compensatory mechanisms that constrict your blood vessels to maintain blood pressure. This vasoconstriction can artificially elevate your reading. Simultaneously, your body releases stress hormones like cortisol and adrenaline in response to low blood sugar, further increasing your heart rate and blood pressure. For someone who normally runs 120/80, these combined effects might push readings to 135/85 or higher, potentially crossing the threshold into hypertension territory. What's particularly troubling is how often blood pressure is measured during the same appointment where fasting blood is drawn. You arrive at the lab or doctor's office, having not eaten or drunk anything for hours, and the first thing that happens is a blood pressure check. This timing practically guarantees a reading that may not represent your typical numbers. If you're having fasting blood work, consider requesting that your blood pressure be measured at a separate appointment when you're properly hydrated and nourished. If that's not possible, at least mention your fasting state when your pressure is taken so the measurement can be interpreted appropriately. And remember to drink plenty of water after your blood draw is complete. Rehydrating can help your pressure return to normal more quickly.
The fourth test affecting blood pressure readings is one you might not immediately associate with cardiovascular effects: thyroid function tests. While the test itself doesn't alter your blood pressure, misinterpreted thyroid results due to medication interactions can lead to treatment decisions that dramatically impact your blood pressure over time. Certain blood pressure medications, particularly beta blockers like metoprolol and propranolol, can artificially alter thyroid test results, leading to incorrect diagnoses of thyroid disorders that then affect how your blood pressure is managed. Beta blockers can decrease the conversion of the thyroid hormone T4 to its active form T3, potentially creating lab results that suggest hypothyroidism even when the thyroid is functioning normally. If a doctor sees these results without recognizing the beta blocker influence, they might prescribe thyroid medication unnecessarily. Once on thyroid replacement, patients often experience increased heart rate and blood pressure, a natural effect of increased thyroid hormone. This creates a confusing cycle where blood pressure rises, leading to increased hypertension medication, which further affects thyroid tests, creating a cascade of unnecessary medication adjustments. Conversely, certain blood pressure medications like calcium channel blockers can occasionally create false normal thyroid readings in patients who actually have thyroid dysfunction. The result? A misdiagnosis of a condition that could be contributing to their hypertension in the first place. If you're on blood pressure medication and undergoing thyroid testing, ensure all your healthcare providers are aware of your complete medication list. In some cases, it might be appropriate to temporarily pause certain blood pressure medications before thyroid testing, under medical supervision, or your doctor might need to interpret your thyroid results with your medication effects in mind to avoid treatment decisions that could worsen your blood pressure control. The fifth and perhaps most commonly overlooked test affecting blood pressure is the routine urine analysis. Standard urinalysis is part of almost every complete physical, but few patients realize how the timing and collection method can significantly impact both the test results and your blood pressure reading. The physical act of providing a urine sample, particularly when done under time pressure in a medical setting, activates the sympathetic nervous system in many patients. This performance anxiety can temporarily spike blood pressure by 10 to 20 points, often right before your pressure is measured during the same appointment. Beyond the stress response, the bladder itself has direct connections to blood pressure regulation. A full bladder stretches and stimulates pressure receptors that can raise your blood pressure by 10 to 15 points on average. Conversely, the relief after emptying an overly full bladder causes a sudden pressure drop in some patients. This means your blood pressure reading could vary significantly depending on whether it's taken before or after your urine sample is collected, a timing detail rarely considered in busy clinical settings.
There's also a crucial medication interaction to consider. Many urinalysis tests screen for protein in the urine, which can indicate kidney problems. However, certain blood pressure medications, particularly ACE inhibitors like lisinopril and ARBs like losartan, can cause harmless protein spillage into the urine that might be misinterpreted as kidney damage. This could prompt unnecessary additional testing or medication changes that further complicate your blood pressure management. If you're taking these medications, make sure your doctor knows when interpreting your analysis results, and consider requesting blood pressure measurements both before and after providing urine samples to understand the full picture of your cardiovascular status. Now that we've uncovered these 5 hidden test interactions, what practical steps can you take to protect yourself? First and foremost, maintain a detailed health journal. Record every medical test you undergo, along with blood pressure readings taken before and after. This simple practice creates a valuable pattern that helps identify which procedures might be affecting your numbers. Second, schedule dedicated blood pressure check appointments that aren't combined with other tests whenever possible. This provides the most accurate baseline for your true pressure. Third, always inform every healthcare provider about recent tests you've undergone, even if they seem unrelated to your blood pressure. And finally, consider investing in a quality home blood pressure monitor to track your own patterns over time. The data you collect at home, away from the stress of medical settings, often provides the most reliable picture of your true cardiovascular health. I've seen countless patients unnecessarily started on medication or having their dosages increased based on blood pressure readings that were temporarily elevated due to these 5 medical tests. The physical and financial costs of these misinterpretations can be substantial. Extra medications mean additional side effects, drug interactions, and pharmacy expenses. But armed with the knowledge I've shared today, you can be your own best advocate. Ask questions, request separate appointments for blood pressure checks when appropriate, and always ensure your complete medical history, including recent tests, is considered when interpreting your readings. Remember, white coat hypertension, that phenomenon where blood pressure rises just from being in a medical setting, affects up to 30% of people diagnosed with high blood pressure. Add in the effects of these 5 tests we've discussed, and you can see how complex accurate diagnosis becomes. But don't let this discourage you from seeking proper care. Instead, use this information to partner more effectively with your healthcare providers. The goal isn't to avoid necessary testing, but to ensure the results are interpreted correctly within the full context of your health profile.
If you've made it this far, you likely understand the challenges of managing blood pressure and navigating the complex healthcare system. I want you to know you're not alone in this journey. The channel you're watching now was created specifically to build a community of support for people like you who are taking an active role in understanding and managing their cardiovascular health. Each week, we share new discoveries, practical tips for natural blood pressure management, and answer the questions that doctors often don't have time to address during brief appointments. Living with hypertension can feel overwhelming at times. The constant monitoring, medication adjustments, and lifestyle modifications require ongoing commitment. But small, consistent changes yield powerful results over time. If today's content has been valuable to you, consider subscribing and activating notifications so we can continue this important conversation about protecting your heart health. I don't promise miracle cures or overnight transformations, but I do commit to providing evidence-based information that empowers you to make informed decisions about your healthcare. Your heart works tirelessly every moment of every day to keep you alive. Each beat represents another chance to care for this remarkable organ that asks so little yet gives so much. Whether you're newly diagnosed with hypertension or have been managing it for years, remember that knowledge truly is power when it comes to cardiovascular health. By understanding how these 5 common tests interact with your blood pressure, you've taken another important step toward ensuring that the care you receive is truly appropriate for your individual needs. Your heart deserves nothing less than the most accurate assessment and personalized treatment approach possible, and now you have the information to help make that happen. Beyond these 5 tests, there's another critical factor affecting blood pressure readings that deserves mention: medication timing. Many patients take their blood pressure medications at various times throughout the day, often not realizing how this affects their readings during medical appointments. For instance, if you normally take your medication at 8 a.m. but have a 9 a.m. doctor's appointment, your blood pressure might be measured right at the peak effectiveness of your medication, showing artificially low numbers. Conversely, if your appointment is in the late afternoon but you only take medication in the morning, your doctor might catch you when your medication is wearing off, revealing higher numbers that don't represent your average daily pressure. This timing issue becomes even more complicated when considering the half-life of different blood pressure medications. Some drugs like amlodipine have a long half-life of about 30 to 50 hours, providing relatively stable blood pressure control throughout the day. Others, like captopril, have much shorter half-lives of only 2 to 3 hours, creating more pronounced peaks and valleys in your pressure control.
Without understanding your specific medication's profile and when you last took it relative to your blood pressure measurement, both you and your doctor might misinterpret your cardiovascular status.
I recommend creating a medication schedule that optimizes your blood pressure control based on your daily routine and when your pressure naturally tends to fluctuate. For many people, blood pressure follows a circadian rhythm, typically rising sharply in the morning, a dangerous time for heart attacks and strokes, remaining relatively stable throughout the day, and then declining during sleep. Working with your healthcare provider to time your medications to address your specific pattern can make a tremendous difference in both how you feel and your overall health outcomes. When attending medical appointments, always note the time you last took your blood pressure medication. Some doctors even recommend bringing your medications with you and taking them after your blood pressure is measured during the appointment rather than before. This approach provides a more consistent baseline for tracking your pressure over time. If you're monitoring at home, try to measure at the same times each day, ideally both before medication to see your baseline and 2 to 3 hours after to confirm the medication is working effectively. Another aspect of blood pressure management that's frequently overlooked is the impact of chronic pain on your readings. Many Americans live with ongoing pain conditions like arthritis, fibromyalgia, or back pain, not realizing how significantly these conditions elevate their blood pressure. Pain triggers a stress response in your body, releasing hormones that constrict blood vessels and increase heart rate. For patients with chronic pain, this can mean blood pressure readings that are consistently elevated, leading to hypertension diagnoses that might be managed more effectively by addressing the underlying pain. If you're living with chronic pain, make sure to communicate this clearly to whoever is measuring your blood pressure. The level of pain you're experiencing during the reading should be documented alongside your numbers. Some healthcare providers even use a dual approach, measuring your blood pressure, then addressing your pain with appropriate treatment and measuring again after your comfort improves. The difference can be striking. I've seen readings drop by 15 to 20 points simply by alleviating a patient's pain before taking a second measurement. Sleep quality represents yet another critical factor in blood pressure regulation that intersects with medical testing. Poor sleep, whether from sleep apnea, insomnia, or simply not getting enough hours, significantly impacts your blood pressure both immediately and over time. A single night of inadequate sleep can raise your blood pressure for the entire following day. Chronic sleep issues can lead to persistent hypertension that becomes increasingly difficult to control with standard medications.
If you are undergoing any of the 5 tests we discussed earlier and experiencing sleep problems around the same time, you're essentially creating a perfect storm for blood pressure elevation. The test effects combined with poor sleep can push your numbers into concerning territory, even if your baseline pressure is normally well controlled. Be particularly mindful of this connection before overnight hospital stays for testing, as the unfamiliar environment often leads to poorer sleep quality. For optimal blood pressure management, prioritize consistent, quality sleep as much as you focus on medication adherence and dietary choices. Aim for 7 to 8 hours nightly, establish regular sleep and wake times, and address potential sleep disorders like sleep apnea. If you're having your blood pressure measured after a night of poor sleep, make sure this is noted in your medical record so the reading can be properly contextualized. The emotional component of blood pressure control deserves special attention as well. Beyond the well-known white coat syndrome, your emotional state during any medical test can profoundly influence your readings. Anxiety, worry, frustration, and even excitement trigger your sympathetic nervous system, releasing adrenaline and other stress hormones that immediately raise your blood pressure. This emotional response isn't just limited to the moment of measurement. Anticipatory anxiety about test results can elevate your pressure for days before and after the actual procedure. I encourage all my patients to practice brief relaxation techniques before any blood pressure measurement. Something as simple as 5 minutes of deep, diaphragmatic breathing can reduce systolic pressure by 5 to 10 points in many people.
Progressive muscle relaxation, guided imagery, or mindfulness meditation can be even more effective with regular practice. These techniques don't just lower your numbers during measurement, they provide valuable tools for managing the daily stress that contributes to chronic hypertension. Remember, hypertension management isn't just about reaching a number goal, it's about improving your overall cardiovascular health and quality of life. The most successful approach combines proper medical care, lifestyle modifications, stress management, and the self-advocacy skills to ensure your blood pressure is being assessed accurately in every situation. With the knowledge you've gained today about how these 5 tests affect your readings, you're better equipped to partner with your healthcare team for truly personalized and effective blood pressure management.